Hello, nurses, and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager, and I'm your host. And I am just recording this brief intro that we have a bonus episode for you today because Monique Class and I have a big announcement that impacts the future of functional nursing and nurses' role in healthcare. So I am going to add that recording here for you, and I'll see you back at our regular time for our next scheduled episode as well. Enjoy. Hello, everyone. Welcome to our special webinar with you today, where we have some really exciting things to share with you. If you are not familiar with us, I just wanted to take a moment to introduce the two of us today. So, my name is Brigitte Sager. I am a family nurse practitioner. I teach functional medicine and nutrition for nurses at the Integrative Nurse Coach Academy, and I am the host of the Functional Nurse Podcast. And I am really excited for a new opportunity that we want to share with you today. And I first wanted a chance for Monique to introduce herself as well.
Oh, Bridget, I'm so thrilled to be here.
Yep.
So I'm Monique Class, and like Bridget, I'm a family nurse practitioner, and I am a senior faculty member for the Institute for Functional Medicine and senior faculty member for the Center for Mind-Body Medicine. With, I don't even want to count the years, something like 35 plus years experience in a clinical setting using functional medicine and mind-body medicine. So I'm thrilled to be here with you.
And I will say, if you have not heard the Functional Nurse Podcast, I interviewed Monique a couple months ago. So you can go back and listen to our full conversation there, which is really fun. Before we dive in, I want to let you know that we have saved something really exciting for the end of the webinar. So if you want to stay tuned until the end, then I'm going to share some important information with you. But first, we have some really exciting things to talk about.
Yeah. So, nurses are becoming the leading sector in this functional medicine movement. We are the fastest growing profession in functional medicine. And it's just a great time for us to be an important part of the collaborative care team and align with the vision and mission of the Institute for Functional Medicine, which is bringing functional medicine to everyone, to hospital settings, to doctors' offices, to every place that we as nurses are. So we are leading the charge, and they are supporting us in moving forward and encouraging us to be part of the movement. So with that, Bridget, tell us what's going to be happening.
Yeah, so I know that a lot of my students have had a lot of questions about IFM has announced that they're making changes to their certification process. And so the question is like, what does that look like and how does it apply to nurses? So the Institute for Functional Medicine recognized that they wanted to create a more streamlined process for prescribing and non-prescribing type providers. So non-prescribing, they heard feedback from nurses and dietitians, other practices where they're not using prescriptions in their actual practice. It's not in their scope. Those folks were taking the same exam that people were that are prescribing. And IFM recognized and took that feedback and they said, okay, we want two tracks now. So we want one for like nurses and dietitians to do their certification. And then we will have another one for folks that are doing prescribing. And so that is currently being revised. And the certification process, they're anticipating that the timeline will be that the first test, they'll have a practice one, but the first one will be in early 2026. And I really appreciate that they've taken that feedback. I really take that to heart with my students giving me feedback on what they want next. And I feel like we're making some huge progress with that, with this opportunity. And Monique has some insights into those actual competencies that IFM has been developing.
Yeah, so IFM's working very closely with me and Bridget and has shared with us the new core competencies for nurses so that we can go through and take the non-prescribing certification, which is really exciting. So we are thrilled. You do need to be a RN or BSRN to take the non-prescribing track for certification. Of course, APRNs, you're going to take the prescribing track, but we're really going to focus on this large growing body of RNs that are supercharged and interested in functional medicine so that we can get you trained and understanding the core competencies so you can fly through the exam, pass the exam, and be a really important part of the collaborative care team to make this happen and to push the movement forward. So with that, what we did is we kind of brainstormed together and decided to create a new entity called the Institute for Functional Nurses, where me and Brigitte are going to be working very closely. And we've been behind the scenes for months, kind of
Yep.
putting this all together and talking to IFM about the core competencies. And we're going to be rolling out this track for nurses, this educational track for nurses. And we're just so excited to
Yes.
be working with you all. So Brigitte, tell us, more about the program itself and the structured program.
So the program is going to start in 2025. So we are still getting our information, getting the competencies organized and content, working closely with IFM on all of that. So we're going to be taking what you might otherwise learn from IFM if you were doing a medical track and translating that into the language of nursing. And so we will be setting this up. I take all the feedback, like I said, so I know how nurses want this to be presented to them and how they learn well. So we're going to have, just like in a university setting, a 2-semester program, and it'll be more like the divided up where we get more advanced on a lot of the same topics in semester 2. And so nurses are going to get the foundational and advanced levels. And by the time they're done with both semesters, they will have completed the amount of time that IFM is requiring for certification. They will have met all of those competencies and gain knowledge to be able to test well in those competencies, and they will be ready to sit for the exam. And we're still figuring out our exact timeline for when the course is going to launch, but our goal is to try to get nurses trained and ready to sit for that first exam window in early 2026. And so the content is going to be appropriate for all nursing professionals. So RNs and nurse practitioners can take this content. It is going to be the same type of content that you would get at IFM in the nursing language. And then a nurse practitioner might choose to take the prescribing provider testing at the end of the program. So I encourage you, if you have any questions about whether you meet the criteria for certification, or if you are wondering what the changes are that IFM is creating right now, I encourage you to go to their website and read about all that and see if what you've done already counts and where you're at and if you meet the criteria for certification. But we're really excited to be creating content that's going to get nurses prepared for that process.
Yeah. And so, we're working really closely with IFM so that we're right on track so that you guys get everything you need to feel confident that you could pass the exam, but not only pass the exam, that you really deeply understand cause medicine or functional medicine, and you can explicate it in whatever area of nursing that you're working at. So it's really within the scope of practice of nursing, using nursing language, as Brigitte said, and that's the most important. And that's the defining part of this whole thing. It's nurses teaching nurses. So, Bridget, you have a background in education as well, right? You have
Mhm,
a
mhm.
yeah. So you have a big background in education as a degree. I've been working with Yale in the clinical setting, taking nurse practitioners and nurses through a functional medicine clinic for the past 15, maybe 17 years. So I have a strong background in clinical medicine and teaching nurses through the clinical lens. So let's talk about the next exciting thing that we're doing, Bridget. Why don't you
Yep.
tell people about the membership that we're going to be rolling out?
Yeah, so that is what we have coming up a little bit sooner than the other things that we've been talking about. So the semester program that we've been talking about so far, we're going to figure out launch dates and everything in the next few weeks to months. And I'm going to give you information on how to stay informed before the end of the webinar so that you will be the first to know when we know what's going to happen for signing up. So in the meantime, I feel like one of the biggest things that, we've had over 800 students now do the functional medicine for nurses program. And their feedback is that they want connection. They want people to support them through case studies, and they want that clinical component and putting this into practice and what that feels like, but also the connection of, a lot of the times we talk about how this can be a lonely space for us, especially if we're doing telehealth. And so an opportunity for like-minded nurses and nurse practitioners to connect in a community. So we are launching a membership. It is the functional nursing membership, and it starts the beginning of January on January 4th. And this will be Monique and I leading a community online. So a place for you to connect where you can be in discussion boards and connecting with others and organizing meetups. We're going to work through case studies, and people can post their questions, HIPAA compliant in there, and like get some support and guidance from other nurses. But also, it is going to include a robust amount of actual live connection, because we're going to have 4 live meetings a month, where, at least to start right now, it's Monique and I, and we're going to be leading these meetings with you. Monique in particular is an absolute master at being able to walk you through live case studies. So ones from her own practice. We're going to have students able to become potentially the person that month that gets to present their case study, and have Monique support them through that. We're going to also have a lot of other types of meetings where we're going to have guest speakers or hot topics that we are seeing come up a lot in what we're learning and what we can share with you. And then a lot of those types of meetings that some of you may be familiar with if you have learned from me in the past, where an opportunity to connect and talk about some of the things that we have in common when we're learning functional medicine. So we are extremely excited about that. It is something that you can take advantage of early pricing of now. So you can go to fxnursing.com, and there's a link here too if you're watching this live. So you can go to fxnursing.com, is for the Institute for Functional Nursing. And if you look at the membership page, then you can sign up there, and we have special pricing available right now. And Monique's going to tell you a little bit more about why this is such a unique opportunity.
It's a unique opportunity, number one, because we can come together as a community and discuss it through the lenses of nursing, and we can answer your questions in real time, work on your cases in real time, and tell you what's going on in the space in real time, the current trends, the current research, so that you're always up to date and you're engaged. You feel like you're part of a movement, and you're supported not only by us, but by each other. You're going to create a new network of friends, a new network in general. The energetics of this are going to be really, really powerful. So we're thrilled about the membership component, and we're going to bring in surprise guest speakers in the
Yep.
space that are doing really cool things. So look out for that. They'll be popping in here or there, and we'll let you know. But we're here to support you, and we're excited to engage with you. It's going to be a dynamic process, meaning we want to get feedback from you, and it's ever evolving and changing based on what your needs are and what you're interested in. That's what we'll do. We're going to pivot on a dime depending on what your feedback is. A membership is a great place to do something like that, because curriculum is pretty set, but this is going to be fluid, flexible, and dynamic, and ever changing and current.
So you can go to the website to check out more about that. So it's fxnursing.com. And what I know right now, a lot of you that have taken a lot of the courses through Inca and have maybe done the functional medicine for nurses course with me, you probably have a lot of questions right now. So to the best of my ability, I want to try to answer some things for you. I am going to continue to teach cohorts 13 and 14 that are coming up in January, and then again in April. And so that's the 12-week program that I teach through Inca that is in partnership with the Institute for Functional Medicine. So that is still there if you want to take it. And so this course that we are developing is a full program. So it is essentially year long, because it's 2 long semesters. And so the difference being that at the moment, I'm teaching basically the foundations of functional medicine, and we're going to take that to the next level and include the deep dives similar to IFM's advanced practice modules. We're going to be going that far with it. So you are welcome to still take those 2 cohorts if you're interested in the foundations course. And then I'm going to continue to also teach nutrition for nurses through the Integrative Nurse Coach Academy. So if you're interested in that, that is something that I'm still going to be offering as well. Current students and alumni of the Functional Medicine for Nurses program, we are working really closely with Inca. We really value the fact that, from the beginning, I've talked about once there's a process for certification, we're going to be on top of that. We want to make sure that we're helping you in your practice moving forward. And, we wanted to have a certification come to be that was specifically for nurses. And this is a really great opportunity for us. IFM is the respected leader in functional medicine. And so for them to offer a new way for nurses to become certified in this really wonderful aspect of healthcare, I think it's fantastic. And so IFM is going to continue to be supporting you through this. And also the Integrative Nurse Coach Academy and us at the Institute for Functional Nursing, we're working really closely with them to develop information that we're going to send in the next few weeks where we can let you know, discounts and a way for you to bridge over if you've already done that program and what that's going to look like because we're really excited to have you with us if you want to continue to develop your functional nursing skills. And Inca is going to remain the place for becoming a nurse coach. You know, that Monique has been a part of that connection through Inca from the start. You know, she's really dear friends with the founders and has always been a fun connection for us. And then she has all of her connections from IFM that we're really excited that they're all super excited about nurses becoming a bigger part of functional medicine. So I don't want anybody worried. We don't have all the answers yet because we need to figure out a launch date and pricing. For now, it's the membership is what we do have answers about, but I don't want anybody worrying if you have done anything with Inca. We're absolutely going to have answers for you soon about exactly what that's going to look like for you to be able to transition over if you're interested. And we're going to offer specifically unique discounts and incentives for Inca alumni nurses from the functional medicine program to come over to us. And I know, you know, I touched on it a little bit, but I know that one of the questions is going to be, how is this different? And so I just want to really clearly say that at Inca, I was teaching you like a foundations of functional medicine course. And if you wanted to become certified after that, you needed to go take all 6 advanced practice modules through IFM. And so this course that we're building now is much more robust and is going to be the equivalent of that for nurses, but they deliver that typically in like 3-day windows throughout the year. And we're going to have it more as a semester program so that you don't feel like you're like cramming too much. It's like, we don't want you to be information overloaded. So if you have already completed programs with me, watch for that coming out because Inca is helping us and we're going to reach out to you and let you know more details. And then I just think it's really important to reiterate that, like, you know, this is the next step. Functional medicine has grown. IFM is like, oh my gosh, you know, nurses are the fastest growing body of healthcare professionals that are seeking functional medicine education. And I have always felt like the person that could help me to address this need is Monique. And so I'm really excited that we're able to offer this for you. And so I want to remind you, you can go to fxnursing.com to learn more about all this and sign up or get on a list to be notified when we have more information about the semester program.
Well, I'm so excited. I can't wait to work with you
Yep.
all. And I'm thrilled to be working with Brigitte. She's been a rock star. I've reviewed her content. It's stellar. It's fantastic. So, you know, together we're going to move it forward so that you could sit for certification and really be a linchpin of the movement.
Absolutely. I am so excited about all this. I'm extremely excited to have Monique as my partner in doing this. I couldn't think of somebody better to do it with. And I know you as the students are going to just really benefit from all her experience. And I'm excited because she has a lot of great friends in functional medicine that we can have on as guest speakers. And so I love that IFM is so excited about this too. Learn more at the website, and then we will post this. If you had to join us late or drop off early, we're going to have the recording posted for you. And once again, it's fxnursing.com. Take care, everybody.
See you soon.